Hi, my name is Cindy Stein. I'm going to address patellar tendonitis today with the technique called Graston technique. This is an instrument-assisted technique that uses specific instruments to smooth out tendons and muscle that have been overused and have developed scar tissue. Typically, when I treat patellar tendonitis, I not only treat the area that's painful, which is where the patellar tendon comes into the tibial tuberosity, but I also treat the quadriceps and the hamstrings, because with injury you can develop fascial restrictions which can lead to imbalance in these two muscles, leading to overuse syndromes. So the first instrument I take, and I basically just scrape the quadriceps, and I look for any areas that feel gritty. It's typical in this for it to become red, and sometimes after the treatment the patient will be bruised. How's that feel?
Feels good.
And he doesn't feel too bad in this. A little bit of grit around the top of the patella. And then obviously I do the same thing to the back, to the hamstrings. And typically the hamstrings tend to have a lot more areas of grit in it. The instrument that I actually use to treat where the tendon comes into the bone is this one, and he is complaining of it about an inch above the tibial tubercle. And his complaints happen when do you feel pain with this?
When I climb stairs, when I use a bike, stuff like that.
And he's had this for about 3 months and has tried ibuprofen and ice and so on, and it just hasn't done anything. Now, when I do this, I actually have a sense of it there being a piece of scar right here. And so what I do is I go in and I dig in and I smooth. And I smooth in both directions, not only above the patella and around it, but he needs it most below the patella, the infrapatellar tendon. The other thing that you do with Graston is you do active movement with it, and that tends to allow the fibers of the tendon and the fibers of the muscle to be worked in a different mode. So I'm going to ask him to extend his knee and then flex it. Extend and flex. And I can really feel it on that. You can too, can't you?
Yeah.
Extend and flex.
What does it feel like to you when you extend it and she does it?
Extend. It feels gritty. In my experience, Graston technique is extremely effective for treating patellar tendonitis, and I suggest anybody out there that has this to give it a try. Thank you.